Hi, my name is Bruno. I work at Brighton Implant Clinic and I'm going to talk to you today about how we helped a lovely patient who came to see us needing some dental advice and some help from us. And it was really a pleasure to be able to be in this position to help someone like Lisa. Lisa basically has a very common problem, like many of the patients that come to see us, whereby her natural teeth were failing. And basically after consulting with us, we came to the conclusion that dental implants was going to be a long-term predictable solution for her failing teeth. The main problem that brought Lisa to see us is that with natural teeth failing, one of the most common reasons that adults will lose their teeth is because of loss of bone support around the natural root of our teeth. And essentially what happens is, over time, all of us will lose some degree of bone support around our teeth, but some of us will actually lose this loss of bone at a faster rate because of various problems. It can be sometimes genetic, it can be lifestyle, can be social habits like certain medications. They can basically lead to people being more predisposed to losing bone support around our teeth. And essentially, if you imagine if our teeth were like this stylus that I'm holding, the bone is essentially what's actually holding this stylus nice and supported. Over time, if we lose bone around this, essentially this may become a little bit mobile, and that's what causes our teeth to become mobile and uncomfortable in later years in life. As this is a very common problem, many patients will speak with the dentist. The dentist will basically outline the options that are available, and very often it means that we're losing teeth, and the most simplest and less invasive solution would be just a removable denture. So with a removable denture, essentially it's something that actually makes you feel quite low, because it is essentially a very simple and straightforward solution, but it basically reminds you of your tooth loss. And losing teeth is a very psychological, emotional, a very impactful scenario for anyone to go through. And so we have a sense of loss when we're losing teeth, just like as if we were to lose a limb in our bodies. So losing teeth is very traumatic, and so many patients, they don't want to lose teeth, and so they try to hold on to their teeth for as long as possible. But unfortunately, over time, as the reasons that we're losing bone around teeth, by keeping teeth for longer, we actually tend to lose further amounts of bone, and we actually make treatment more complex and more difficult in the future if implants are to be considered. A very interesting pattern is that gum disease will normally affect the posterior teeth mostly or first, and those are usually because those teeth are more difficult to access in terms of cleaning. They're also multi-rooted teeth, and what tends to happen, patients will lose these back teeth first, and they will try to hold on to obviously their front teeth that are visible, so when they're smiling they can still see. And after losing these back teeth and also losing some lower teeth that are out of sight, we tend to find that the remaining teeth become overloaded. They tend to work more because we're missing those posterior teeth that basically provide the teeth that we need for grinding food and actually chewing properly. So the deterioration curve actually goes up kind of quite fast once we start losing those back teeth, and then we start depending on our anterior teeth for general function. So when Lisa came to see us, she still had most of her anterior teeth remaining, but what tends to happen, as you can see from the photo, you start to see some spaces developing between the teeth, all right? And because we're losing our back teeth, our teeth tend to splay forward. So as we start to overload our teeth tend to splay more forward because we don't have those back teeth to basically keep the pressures off those front teeth. So you can see from the frontal approach, and you can see over here, you can see the small spaces that become evident on the sides. So these small gaps that become apparent, they're basically because the teeth need each other to be supportive. Again, you can see over here the spaces that are left behind. And this we can confirm also on the scan, that we can see over here. You can see we've got some spaces between the teeth. Normally these teeth would have been closer together and they would have been nicely aligned, but after losing those back teeth, they start to become more splayed apart. And in Lisa's particular case, she had already lost the lower teeth because these were more susceptible to gum problems. So she already had very limited amounts of chewing ability because of no natural teeth remaining in the lower jaw. So basically during the first consultation, we take a detailed report, basically make sure that implants is going to be the right solution for patients, make sure that they understand what treatment's involved, and we take a 3D bone scan that basically allows us to see and visualize all the bone structures, all the problems that exist before treatment can commence. So as you can see here from Lisa's scan, this is the patient's left side over here, and this is right. And this area here that you can see is actually where the bone exists, this area. And in the mouth, essentially that is kind of this area here, all right? So this upper area is generally where we see most patients have some degree and amount of bone. The challenging part with many patients that needing this type of treatments is, in Lisa's case, we normally have implants that go from this area to the sides, and it doesn't provide a wide span of support for future teeth. So in this case, normally a standard all-on-4, we would have one implant somewhere here, another one here, and one here, all right? And this would basically give us a good amount of support for 10 teeth, maybe even 12 teeth. With Lisa's case, we actually added an extra implant further back here. These are called pterygoid implants, and these basically give us the maximum amounts of support for the upper jaw. Like this, you have a very stable base for the future teeth to be supported, and with 6 implants, when possible, it's going to be superior than having just a 4 implant solution. They are a little bit more difficult to carry out, but they provide really great advantages in terms of aesthetics and in terms of support. The lower jaw was just a standard conventional all-on-4. So we have some important structures that we need to avoid, this being the nerve on either side, and these implants are placed in a normal all-on-4 configuration like this. So in Lisa's case, this actually worked out really well. We had normally less amounts of bone in the lower jaw because the teeth had been missing for a longer period of time. We first started with the upper jaw by removing those teeth that were actually causing her a lot of discomfort. And because they were the teeth that were most troubling at the beginning, we basically removed those first. And here at the practice, we basically were able to do that with the help of an anesthetist. Basically, the anesthetist provides a very deep level of sedation, so it's very comfortable. And the procedure takes about 3 hours. So we basically have those teeth removed, and at the same time, the implants are placed. So with sedation, you have different levels of sedation. For bigger procedures, it's recommended that there is a consultant anesthetist that basically provides a safe and profound level of sedation, especially for longer procedures and procedures that are a little bit more invasive. So for patients, essentially, you're walking in and you're going to undergo the procedure in a very comfortable setting. You're going to not remember, and you're not going to experience any of the surgery that's taking place. And patients don't feel nausea afterwards. It's actually very pleasant. They generally feel very well. So with the procedure, we're basically taking some really detailed photographs before and some 3D scans using digital intraoral scanners. And what we're going to be trying to create is a new smile. And we do this using design software where we actually create a set of teeth. Now, these teeth are not permanent teeth. These are basically temporary teeth that are fitted usually on the day of surgery or the day afterwards. And the patient is able to go away and actually understand and experience fixed teeth. The teeth may be in the perfect positions as a first attempt, but quite often we basically need to re-establish where the bite was, where the smile needs to be, and make sure that it's symmetric with the eyes, with the lips, and basically just the whole facial shape. And this is such an important part of the treatment because unlike what we were able to do before, whereby we didn't have digital dentistry, things were usually made as a finished solution, or sometimes we would be able to test these solutions in wax. So it's very difficult for patients sitting in a chair. They weren't able to actually go home with a trial set of teeth. We're able to eat with them. So with this workflow, what we're able to do now, we actually 3D print the teeth. You go home with those set of teeth and you can actually see what they feel like, how they function, how your speech is affected. And then very often patients will come back and they'll say to me, look, this is working well, but I feel like I need to adjust one area of my bite. It doesn't feel quite right. We can then correct that, make another trial set of teeth, send the patient away for a few weeks, see if that works. And we keep going closer and closer to the ideal result. We're taking detailed photographs and small shorts of video of patients even speaking with these teeth, so we can see that those teeth actually work well and are conducive to their facial profile. After 8 weeks, as I said, we then start to take those final records and we start to make the final bridge. And the final bridges in this case were made out of zirconia and titanium. So previously we used to use zirconia bridges for already several years, and now those bridges have been improved by the incorporation of a titanium frame inside the bridge. This really gives the bridge more longevity. The bridge is stronger and it's more precise than ever before. So as you can see with the titanium and zirconia bridge, you basically have not only the teeth elements that are here, but this over here is the zirconia that's been layered with a pink porcelain, and that pink is basically to recreate not only the volume that's been lost due to gum disease, but also to provide a aesthetic artificial gum tissue so that when patients are smiling, they're able to display the correct proportions and the correct symmetries of the teeth and tissues that they've lost. So given the extent of bone loss and tissue loss that we had with this particular case, the type of bridge needed to replace both teeth and soft tissue. You can see over here, this is just the titanium parts on the inside that are essentially incorporated into the bridge. And here you can see this is the titanium bar. So it's this section over here. And we basically then have all these areas over here. Unlike what used to be done before, this is all custom milled out of one piece of titanium. It's super precise. It fits incredibly accurately onto the implants, given the nature of the scanners that we use. And those scanners that we use here are photogrammetry, iMetric. It is the gold standard of taking impressions for this type of work. Once the bridges are fitted, obviously the mechanics and those parts that are basically holding the implants in place, they're hidden by the lips. So as you can see here from the smile, we make sure that the teeth are correctly aligned, that the teeth basically follow the curvature of the lower lip. And we basically want to have these teeth already trialed and tested a few times before to make sure patients are happy with them. Obviously going through this process, we sometimes taking weeks, months, where we're together with the patient, and it's incredible for myself and my team to see the change that teeth can make to a person's overall, their personality, their approach. And gosh, it was incredible to see Lisa, how confident and how warm she felt, and how much better an improvement that she felt when coming to see us. Before she was very afraid and quite worried about what the treatment involved, but then once the implants had been carried out, she restored her confidence, and it was just literally so incredible to see that transformation. And over and above all the technology and all the things that we do, the human element, to see patients coming back and actually thanking you and saying, look, I wish I had done this sooner. This has changed my life. And so many other things. Some patients are feeling like, restored confidence in being able to eat and smile again. I hope this story's helps you. Maybe you're having a similar problem, or know someone who's suffering with problem teeth. And well, here being the clinic and focusing on implants, we see patients from a variety of ages, from very young to very late in life, having implants to basically help improve their quality of life. And sometimes patients will feel ashamed that maybe they're thinking the dentist is going to judge me on how poor my teeth are. But you shouldn't feel embarrassed or ashamed, because that's what we're here to do. We're here to help. We can show you the solutions, and maybe the timing's not right for you because there may be several factors that need to be correct for you to be able to start with a treatment journey like this. But it's a very common problem, and fortunately, with technology improving and medicine always getting closer to perfection, we are able to now deliver something that really is very precise, it's very comfortable, and I'm just so glad that this is the work that I do and I'm able to help people. So yeah, if you have any problems, by all means feel free to reach out and we'd be more than happy to help.